On this week's Health Talk, we're going to introduce you to a primary care doctor for the 21st century. She is passionate about helping her patients prevent illness through healthy diet and lifestyle. She assists patients to gain control, lose weight, and in certain cases, even reverse metabolic disease, for example, diabetes. Her advice to her patients is often to balance out macronutrients and eat whole and real foods. So stay tuned for an interesting show. Health Talk is up next. Hello, I'm Dr. Eric Vaser. Today we're going to discuss the health risks associated with an unhealthy weight. My guest is Dr. Stephanie Ortiz Page. She's a family medicine physician, and she's the medical director for the newly launched Metabolic and Medical Weight Loss Program at Nuvance Health. Thank you for joining us. Great to have you. First time on the show.
Yes.
Let me welcome you to the greater Norwalk area. Welcome to Nuvance. It's so good to have you.
Thanks so much for having me here.
This is one of my favorite and most embarrassing topics.
It shouldn't be.
Healthy lifestyle. I've struggled with weight my whole life, up and down 50 pounds. I've lectured on this show how to lose it. I've never told people how to gain it. I think we all know how to do that. So tell us, what's new? We always hear about diet and exercise. What's new in healthy weight maintenance?
Well, wow, I talk about this all the time with my patients. Healthy weight maintenance, there's different pillars involved in achieving a healthy weight. I always talk to my patients about nutrition is the first one, physical activity, behavioral changes, lifestyle changes. In terms of nutrition, really focusing on whole and real foods. So really trying to stay away from processed foods, especially the ultra-processed foods. So what does that mean? Anything that's packaged, anything that's very rich in refined sugars and flour.
So that's stuff you find, dry stuff,
yes,
on the shelves in the supermarket?
Out of the shelves. If anything has a long shelf life, it's probably not too good for you.
Now, why is that? I mean, I understand dense carbohydrates, but why would white rice or something like that, or noodles?
So essentially it's because it's refined, meaning it's processed, and they're very high in sugar and high in carbohydrates. So when we talk about macronutrients, what are your three main macronutrients? They are carbohydrates, they are proteins, and they're fats, and they all have different types within them. So within carbohydrates, there's simple, there's complex carbs. The simple ones are the ones that we really need to be worried about. So those are things like ice cream and chocolate and bagged chips and things like white bread and white pasta. Those are the foods that can become pretty highly addictive.
I think a lot of people don't realize that carbohydrates, the simplest carbohydrate is just sugar.
Right.
And when we talk about complex carbohydrates,
right,
they're these long chains of sugars, and it takes a lot more work to digest those long chains.
Yes.
The sugar gets into your system a lot more slowly.
Yes.
It makes you feel more satisfied.
Yes.
You take chocolate candy, and that's like shooting sugar into your veins.
And it's a big spike in blood sugar, essentially. And those foods can, like I said, be very highly addictive. So I see a lot of patients that have a lot of sugar cravings, and they struggle with stopping, eating juice and soda and candy, and they have a lot of nighttime cravings for these foods. So the first step, especially for someone that's struggling with weight loss, is figuring out what are those trigger foods. What are the foods that you tend to consume a lot of, right? And start eliminating them, because the less that you stimulate your brain and your body with them, the less that you're going to crave them.
Let me ask you an aside of this, and that is artificial sweeteners. My children and I always have an ongoing discussion, my grown children, about artificial sweeteners. Because from one standpoint, you look at them, they have no calories, and you get to have sweet taste. But what does it do to you? Are they good or bad? Do they really ruin your conditioning and make you crave other sweets? That's what I've often heard.
It's not natural, right? There's many different types of artificial sweeteners and what we call sugar alcohols, and many of the processed foods that are labeled as sugar-free, or the sugar-free cookie, or the sugar-free ice cream, they tend to have they still have carbohydrates, and they also have a lot of these, sugar substitutes in them. And yes, they are less caloric. So if you're really struggling with removing high amounts of sugar from your diet, I do suggest, okay, let's switch over to a non-caloric sweetener like stevia or monk fruit or Splenda. However, if you're still struggling with a lot of sugar addiction, you're still having that same response in your system. So slowly you actually want to steer away from even having consuming a lot of those sugar substitutes. So I have a lot of patients that are drinking a lot of regular soda, and then they switch to diet soda, but then they're still having 6 to 8 cans of diet soda a day, and they're still struggling with cravings. And it's because you're still stimulating your brain that, oh, I'm still having something sweet. So slowly you still want to try and stay away from those types of sweeteners as well.
Now, I think we often think of obesity tied to a sweet tooth and desserts and ice cream. From a personal standpoint, that's not my problem. My problem is more excessive carbohydrates at a meal, eating too much at a meal, not properly, not having the signal to say you're not hungry. My daughter-in-law sits and she eats 3 bites and she says, I'm full.
Right.
I eat 3 bites and I'm more hungry than before I started. And by the time I'm finally satiated, I've had too many calories.
Right.
So how, what's the phenomenon? How do you deal with that, other than some behavioral training?
Right. Yeah. So that's actually really interesting that you bring that up, and that's actually one of the big changes in obesity medicine that has happened in the last several years. It actually was not until 2013 that obesity became classified as a disease state. Prior to that, it was essentially, oh, the person has no willpower, the person likes to eat large portions of food, has no self-control, that person is quote unquote lazy. But now we understand that obesity essentially is caused by different derangements or alterations in different metabolic pathways, like what you just explained. So an effect in hunger hormone, which is ghrelin, which is released from the stomach and triggers our appetite regulating area in the brain to tell us that we're hungry. There's alterations in leptin, which is our appetite suppressing hormone, and that hormone's actually released from fat cells. So the disease of obesity is exactly that. So having difficulty is part of that, I guess I should say. There's more to it, but difficulty in having sense of fullness, feeling overly hungry. So in terms of nutrition, for somebody like yourself, if you came to see me in the clinic, what I would suggest is you really want to balance out those macros. So going back to the carbs and the proteins and the fats, and this is without medication, right, which we can talk about later. How can you help with decreasing those cravings? So proteins and fats, well, healthy fats, because there's also different types of fats, actually take longer to digest. They take 6 to 8 hours. So when I talk about balancing it out, it doesn't mean that you have to eliminate the carbohydrates from your diet, but you want to fill up on more non-starchy vegetables, which means those above ground vegetables. You want to make sure you're having adequate protein in your diet. So maybe you have a little extra serving of protein as long as you have good kidney function. And you also want to add even a little bit of extra fat. So focusing on those healthy fats, focusing on those really good nuts and oils, especially olive oil, almost like essentially the Mediterranean approach. There's a lot of data around the Mediterranean approach to
it has, no pun intended, but a flavor of the old Atkins diet.
A little bit. So I think finding a kind of an in-between, a middle ground there between like a low carb and a Mediterranean diet usually is pretty successful.
I can speak to the Atkins diet, which both my wife and I used, maybe it was 15 years ago. And we stuck to it religiously for 6 or 8 weeks.
Okay.
And I will say that it was remarkably effective in suppressing appetite.
Yes, it does.
Remarkably effective. We lost, I don't know, 12 pounds or something like that. But the cravings that finally defeated at the end made it a non-livable diet for the long term.
Right.
Ultimately,
it's hard to eliminate one specific macronutrient from your diet.
I remember craving orange juice, just as almost as an addict would crave orange juice at the end. So but it made sense though that we were eating it's just a lot of eggs, fats, meats. It was all on one side, and I don't think, but it was not as sustainable. So the Mediterranean diet seems to be emerging as the right compromise.
It is. It definitely is, because you're really focused. The other great thing about the Mediterranean diet is that it focuses on whole and real foods. So it focuses on not having those packaged and processed foods, having good fruits and vegetables, balancing, especially including that good protein and healthy fats.
Now, there are food supplements on the market which package vegetables and fruits in little capsules. What's your thought about them?
I think, you know, there's a place for, you know, maybe a specific person to have those types if they're really struggling, if they're having a lot of maybe gastrointestinal issues or they're having trouble digesting, maybe they need to take a supplement like that. But if you don't have any of those issues, then why take a supplement? Yeah. Just have, you know,
have the real fruit.
Have the real fruit, have the real vegetable. You can actually get all your nutrients. You really don't even need that much vitamin supplementation as long as you're having all the right nutrients in your diet.
I'll throw out another thing that I have found helpful during my successful periods, and that is eating more deliberately, being more conscious.
Yes.
So that means when you sit down for a meal, deciding what I'm going to eat before I start eating, rather than saying, okay, I've got a pile of barbecue here on the side and I'm going to eat till I'm full. I can sit down and say, well, I'll have 3 ribs and some, I don't know, Brussels sprouts, and that's going to be my dinner.
Right.
So thinking about it consciously, eating more slowly.
Mindful eating is what I like to call
that's
it.
Exactly.
Yes.
Taking smaller bites, cutting. I mean, it sounds silly.
No, but this is all, you know, standing while you're eating. I mean, I do that sometimes, and then I end up overeating.
Isn't that because you're just too busy?
Yeah, because I'm busy. I have a toddler, you know, I'm standing and eating, and then I'm like, wait a second, I just had, you know, 2 servings of this, and it's because you're not thinking about it. So planning out your meals actually really, really helps, especially when you're starting you know, trying to get to a healthier weight and changing your lifestyle in general. I talk a lot to my patients about starting your week off, whether it's Sunday or Monday. You know, plan what your lunches are going to be. Plan what your dinners for your family is going to be, so that you don't get into that situation where you're stuck and you don't know what to do, or you're doing takeout that maybe you don't want to.
But how about whole wheat versus? You know, I'm always offered brown rice if you want sushi, or you go to a Chinese restaurant, or whole wheat pasta. I mean, there are a lot of starches in our environment that are very, very common. Rice, pasta, bread. Do you recommend the whole wheat variety, and why?
You know, whole wheat, I talk about this all the time. When it comes to bread, I think you should just limit bread in general, because it's one of those foods that I consider a trigger food. It's a trigger food for me. So you just don't, most people, you know, whether it's whole wheat or white or rye, whatever it is, you know, sometimes it's hard to just have one piece of that specific, you know, item, right? Because it can be a trigger food. It's still a it's still a carbohydrate.
Trigger food, what do you mean by that?
So a trigger food is essentially a food you can have a lot of, that's easy to eat in excess. So like chips or cookies, or something like bread. You know, when you go out to eat at a restaurant and they bring a bread basket, do you just have one piece of bread? No, you have the whole, you know, most people will just eat half the bread basket, right? Because it's a trigger food. It triggers a specific reward center in the brain, so your body feels happy. This is why it's so easy. You know, you don't just have one Pringle. You have half of the Pringle box, you know, because you feel good when you're having it. So you really want to stay from whatever that trigger, you know, for someone it can be chips, for somebody else it could be, you know, chocolate. So you have to figure out what is your trigger food? What is it that, what is that specific item that causes you to overeat?
And we've got just a couple minutes left. How do you snack healthily, or should you just not snack?
No, that's a good question. So I always, you know, tell my patients to actually plan out your snacks. So the first thing is clean out your pantry, get out any unhealthy snacks. Fill your pantry with healthy snacks. So you want to have, you know, snacks that are protein dense. So nuts are a snack. Have your non-starchy vegetables. Have nut butters.
But nuts I've managed to gain weight on nut snacking.
They can be high calorie, so that could be a trigger food for you, right? So maybe nuts for you is something that you have to really portion out, because you can easily overeat it. Portion out your snacks. So try not to get anything in big bags. Anything that's in a big bag.
Stay away from Costco.
Costco, I know. It's cost effective. But if you go to Costco, maybe get nuts that are in small bags, you know.
We used to take them out when I was doing well and put them into little baggies, cut out the exact number, half a cup or whatever was 100 calories.
Yeah.
Put into the small baggies.
Right, and that's a great way to do a snack. So if you're hungry, eat. Your body is telling you that, you know, you need something, but you want to snack on the right foods. You don't want to snack on something that's very caloric or that's like a trigger food.
And
like
that's we have to wrap it up here. That's all
Sure.
good advice.
Yeah.
There's so much to talk about. This is such a common problem, and it's so important from a public health standpoint as well as a personal health standpoint. Fortunately, we have run out of time. I want to thank my guest, Dr. Stephanie Ortiz Page, for joining me on Health Talk today. And thank you for watching. Please share your questions and comments with us at healthtalk@newvancehealth.org. We'd love to hear from you. We'll see you next week on Health Talk. Bye-bye.
Learn more at coronavirus.gov.
Obesity can lead to heart disease, diabetes, high blood pressure, and many other medical problems, including a shortened lifespan. Our guest on this week's Health Talk will explain what obesity is and what we can do to prevent and treat it. So please stay tuned for an important Health Talk. Health Talk is coming up next. Hello, I'm Dr. Eric Mazer. My guest today is Dr. Stephanie Ortiz Page. She's a family medicine physician who is the medical director for the newly launched metabolic and weight loss program at Nuvance Health. She advises her patients to balance out macronutrients and eat whole and real foods. So Stephanie, thank you so much for joining us.
Thanks for having me.
This is such an important topic. I don't know, so many people struggle with their weight. I think most people, even if they're thin, are very conscious with their eating habits. Some
Yes.
are just better managing it. So tell us a little bit, what is a structure, how does somebody like, I've struggled with my weight my whole life. I was thin till I was 40, I was athletic. I'm still a struggling athlete, but I'm chubby and I go up and down literally 50 pounds in a shot. How can I get down and stay down for the rest of my life?
Well, going to a structured, weight loss program and finding a specialist that focuses on obesity medicine, and that might be your primary care doctor. Maybe your primary care doctor is comfortable and trained in managing obesity medicine. Not all of them are, because it's unfortunately not part of our training. So there's
what I always hear is just, exercise more and eat less. And,
right.
That I know it, and I'm sure the other 60% of Americans know it. But that's hard to do on a day-to-day, everyday basis.
Yeah, and the science behind that doesn't really make sense, because if you're really restricting your calories, so let's say to under 800 calories a day, how do you expect that person to have the energy to exercise, right?
And actually, from what I understand, the basal metabolic rate, or your
Yes.
daily calorie consumption, you cut down to a starvation level diet, and your body adapts.
Yes.
And it cuts down its calorie use.
Right.
So
right.
you're really struggling against I can talk about things that I thought worked, but go ahead. You're the expert.
Yes, yes. So the main thing is, yes, staying physically active is very important. You want to build muscle, because that's also a reservoir for fuel. So when you exercise, walking is key, and then also incorporating some type of strength training.
Now, can I ask you about that? Because so many studies are done, and they say exercise is not a major component of weight loss.
Right.
I actually disagree with that, and I think it has to do with the way the studies were done.
Yes.
But what are your thoughts as an expert? You agree that exercise needs to be part of it?
It's definitely 100% should be part of it. Is exercise alone going to help you lose weight? Not necessarily. Okay, you still can outrun a bad diet, right? So, but it's certainly part of a structured, weight loss plan. So physical activity is especially important in the weight maintenance phase. Maintaining weight, as you may know, is actually harder for many instead of
well, you
as
look at
opposed
the
to
studies,
losing weight.
almost all of them, where they study weight loss programs, people come down,
Up
and then
down.
you see this slow curve. And if you look 3, 4, 5 years
Right.
down the line, the success is pretty 20%, but it's not.
Right.
You don't get the same
And that's because
60
of
or
the
80%.
body's natural tendency to want to regain weight. This is what causes the yo-yo effect of weight loss and weight gain for many people. Because when you lose weight, doesn't matter what your starting weight is, your body starts saying, wait a second, I want to go back to that previous weight. So then hormones like ghrelin, which is your hunger hormone, starts going up. Your metabolism actually does decrease, especially if you're not building mass, because a lot of people start losing a lot of fat mass. But in addition to that, they're losing fat-free mass, which means your muscle strength. And that can also decrease your metabolism. So then it becomes like a tug-of-war action, where you're trying to keep the weight off, but your body wants to go back to that prior weight. And sometimes those hormones are really hard, to manage, and those hormones can win.
I mean, we're built for sort of a different lifestyle.
Right.
And I don't think, honestly don't believe that back in the caveman days we were ever built to live into our 60s and 70s or 80s.
Right, yeah. But that, in terms of for weight, it doesn't mean you can't lose weight and keep it off though. But it really takes following, so that's where a structured program comes into place, following with an obesity medicine specialist, following with a team.
So tell us more about a structured program.
Sure, yeah.
Somebody comes in to see you and they've got to lose 40 pounds.
Right, so a structured program incorporates, so one, you see a specialist, so you either see a physician or a nurse practitioner or a PA that's trained in obesity medicine. You have a team behind you, so you not only have your healthcare provider, but you have your dietitian, you have a health coach, you have a behavioral health specialist. Many programs also have even exercise physiologists to help you create an exercise plan. So that's one of the benefits of going to a specific weight loss program.
Do you give out daily diets telling you exactly how to measure stuff out the way?
It depends. It's very individualized. For everybody it's different. Some people just need some tips on how to, balance out their foods or meal planning. Some people need, more specifics, right? So it's very individualized.
Now, the other thing, I want to make sure we have enough time to talk about this. For the longest time, there were really two kinds of diet pills. There are the stimulants like the methamphetamine type stimulants,
right,
which reduce your appetite.
Yeah.
Never really, I think, were particularly helpful over the long term. And then things like orlistat, a drug that helped you not absorb as many calories.
Right.
But I've actually read lately a couple of pretty promising articles about what were diabetes drugs that also seem to be having some good long-term effects. I guess they're the incretins and metformin. So we're not advertising any specific drug, but these are different classes of drugs that may help really reset some of the appetite. To tell us about when should they be used? Are you using them? They're not the holy grail, but they seem to offer us a different class of drugs and maybe a more successful long-term outcome.
Yeah, I mean, especially when going back to understanding obesity as a disease state and understanding that there's so many hormonal imbalances, specifically with ghrelin and leptin. So this is actually really amazing that we have now many drug options for patients, and this incretin drug class is really life-changing for many because yes, it can help patients with type 2 diabetes, but it can also now help with weight loss, specifically for weight loss. And it helps with patients that are struggling with increased hunger and feelings of fullness. And then it has the added benefit of stabilizing blood sugars. And then it has the added benefits of research showing that can reduce major cardiovascular events.
And when do you move to the drug therapy from lifestyle and diet modification?
Right, so it depends. It depends on how, typically when a patient comes to see me, we really do focus on nutrition and lifestyle because the medication, yes, it is a treatment option and it does help, but it's not the only piece to the puzzle. Okay, you still have to incorporate the other pillars to have long-term successful weight loss and maintenance.
We should also talk a little bit about gastric bypass surgery or the equivalent,
so
because I know that's been very successful, but that too requires a commitment on the part of the patient. There's nothing that you go into and say, okay, I'm going to just do what I've been doing all along, and this stuff will take the weight off me.
Right.
That doesn't happen.
It can help. It certainly can help, and weight loss surgery is definitely a great treatment option for many patients. But I also can see patients regaining weight after weight loss surgery because they're not sticking to maybe medication to help maintain weight loss, not following up with your provider, not following, with your dietitian and sticking with your good nutrition plan. And then at that point, physical activity, really important for weight maintenance.
Do you have any rules of thumb as to how you choose among weight loss surgery, medications, or just more diet and lifestyle?
I get a lot of patients that come see me. I work with the surgeons. I have wonderful surgeons that I work with here at Nuvance, and I see a lot of patients that see me that are on the fence. And I say it's okay to be on the fence. I think that even if you consider weight loss surgery 3 months from now, starting with good nutrition, lifestyle, behaviors, focusing on improving just your overall health, your overall life, maybe adding a medication there to help you, and you start losing weight and then have weight loss surgery and then continue all of that, you're really setting up yourself for long-term success.
No, we've been remarkably remiss, I shouldn't say remiss, but we haven't talked about calories at all through this. Maybe tell us about your approach to calories.
So
Is calorie counting a good thing?
For some, it can be. You know, I think the main thing to realize is that, you know, not every calorie is accounted the same. So where are your calories coming from? You know, we can put you on a 1,800 or 2,000 calorie diet, but where are those calories coming from? And this is where it goes back to my focus on macronutrients. So you want most of your calories to come from non-processed whole foods. Balance out your calories throughout the day. You know, have good protein intake, add some healthy fats, you know, include your good carbohydrates in there. So it's, you know, some people need, again, it's very individualized. Some, you know, we assess basal metabolic rate, which means how many calories are you burning in a day. And then we can assess, you know, this patient needs to be on this specific calorie diet. And it's not, you know, it's not sticking to it, you know, to the T. I can't go 1 calorie above or 1 calorie below. But it, you know, it does allow for focus. That's also a phenomenon.
And maybe I can ask you about this, where you start on a diet, you control things. Well, first of all, I think it's better not to think of it as a diet, but to think of it as a permanent change. Because if you think of it as a diet, it also means you're going to stop being on a diet and you're going to go back up. But that being said, you start following a more healthy lifestyle, and then you break it. You have a piece of birthday cake, and then I know for a lot of people that's the off switch, and for me too. It'll be off switch. They'll say, okay, I had a piece of birthday cake. I've been dying for those Reese's peanut butter cups. I'll have a few of those. Oh, no, I'm still hungry. There's ice cream in the freezer that I haven't had alone. Let me get. So you get this phenomenon of binging when you've deprived yourself for a period of time.
Right. So you know.
So how do I stop doing that?
Again, so it's a balance, right? So I think it's planning ahead for those days, because we're human. We're gonna have birthday parties. We're gonna want to do celebrations, and you're gonna be exposed to foods that maybe are not part of your day-to-day routine. But you have to, you know, especially if you struggle with those types of foods, and they become almost like a negative part of your life, where, oh my gosh, if I'm going to have this, I'm just going to eat, you know, I'm just going to keep eating. So really training your brain, and that's where the behavioral aspect of weight loss comes in.
I've also found that there's sort of a hump you need to get over. You need to get into a period where you're beginning to see success, and that breeds more success. The problem is getting from here to that initial feeling of success.
So a lot of my patients say, can I never have, you know, a birthday cake again, or when is it okay for me to incorporate that? And I think it's exactly that. I think if you want to see initial results, let's get you to a point where you're starting to lose weight, you're starting to lose inches, because not only just about the weight, right? You're starting to lose inches, you're feeling better, and then we can figure out how to slowly incorporate them in a healthy way.
Yeah, and I just found that during my successful period, if I limited the portion size, I could have something sweet, but severely limit the portion size.
Right.
We only have a minute or so left. We hear a lot on TV and ads about insulin resistance. That's actually an important medical term.
Yes, we talk about
it
a lot.
But it's not what we see on TV. Tell us what insulin resistant is and isn't. Is that a barrier to weight loss?
It can be. So if you're insulin resistant, and that's, you know, going to see a specialist, they can screen you for insulin resistance. And insulin is essentially the hormone that helps regulate blood sugar. It's released from your pancreas. And insulin resistance means that your body is producing more insulin than it needs to break down glucose or sugar.
And my understanding, though, is insulin resistance
is
a result of obesity.
It can be, or insulin resistance can actually trigger weight gain too. So if you're predisposed to insulin resistance, or if you have a genetic predisposition to it, when you're producing high levels of insulin, insulin is a storage hormone. So that's why it can actually trigger weight gain, and then it can lead to more obesity and then more complications of obesity.
And so I know also if you lose weight, you actually reduce your insulin resistance.
And then you can reverse the insulin resistance, exactly.
So that's the way to reverse it. There's no pill that reverses insulin resistance.
There's medication that can help improve insulin resistance, for sure. But again, it's in combination with everything else.
We've run out of time, but there's just so much now that we understand about obesity and managing it. And I think there's, in addition to the behavioral and lifestyle changes, we're really seeing some pharmacologic therapy, and we have a pretty long history now of surgical therapy being beneficial.
Definitely.
So that there's really a lot of should be a lot of optimism. And so I really want to thank my guest, Dr. Stephanie Ortiz Page, for joining me on Health Talk today. Great discussion. And thank you for watching. Please share your questions and comments with us at Health Talk and Advanced Health. We'd love to hear from you. And see you next week on Health Talk.